Hey guys, morning everybody. My name is Dan, I'm a veterinarian, and today I want to take a minute before work to talk briefly about heartworm disease. And I had a client the other day, and a young man, really nice dude, and he was not familiar with heartworm disease at all. And I went through the process of how dogs get heartworm disease, and I figured it would be fun to kind of walk through with you guys and also talk about just some problems I've seen with it when a dog gets it, and then preventative measures. So here's the deal. Heartworm disease, guys, is spread by mosquitoes. Now, mosquitoes, peak season, of course, is going to be the summertime. When we talk to other veterinarians out there, we see a lot more heartworm disease in the South, right? So the Gulf Coast area, Florida, Alabama, Mississippi, all those states that are more southern, the temperature is more appropriate for all the heartworm disease. Now, if you look at any map of heartworm disease in the United States, you're going to see it everywhere. Now, of course, guys, the amount of heartworm disease you see up here in Nebraska, where I work, is going to be significantly less, right? But it's still very present. I treat, our veterinary clinic treats a few doggies a year for heartworm disease. So heartworm disease is spread by mosquitoes, and what happens is you have a mosquito and they are carrying the microfilariae, which is the young juvenile larvae heartworm disease, and they fly over and they bite a doggy, and it's spread by the blood meal from the mosquito. And what happens is it's kind of a long and somewhat like beautiful process of the heartworm being spread. And when the mosquito bites down, it injects the heartworm disease, and it takes a while for a heartworm to go from what we call an L1, which is like the youngest heartworm, all the way to like an L5. Now, L1s, guys, are microfilariae. Those are the really, really small microscopic worms. Those are the ones where a veterinarian may draw some blood and they'll put it on a microscope slide and they will look at it and they will see the worms on microscope slide, like these little worms just like wiggling through the red blood cells. I think I have a few shorts if you guys want to actually see the worms. If I don't, I'll get a video up so you guys can see it in the near future. But that's the L1 phase. Now, the worms will go from an L1 all the way to an L5. So it's a progression thing. And this takes months. We're not going to see a positive heartworm test for maybe 4 to 6 months to get a positive heartworm test. So we go from L1 to an L5. Now, when your veterinarian gives you heartworm preventative, that is going to kill and eliminate heartworm disease in the early stages. So that's L1, L2, and L3, all up to teenagers, right? So that's going to get rid of those. So that includes, guys, everything from like your HeartGuard, your TriHeart, your ProHeart injections. The way you think about it is when you give like a HeartGuard or a Simparica, something like that, it's going to clear the blood of any parasites, right? So it's going to clear the blood of any microfilariae, any L1, 2, or 3s. Now, when you do ProHeart, it basically keeps the blood always clean of any heartworm disease. Now, here's the kicker. If you get to an L4 or an L5, which are your adult heartworms, those are the ones that like to migrate to the heart and cause problems, especially in the right atrium and the right ventricle, those valve areas. If you get to that point, you're kind of stuck. So the heart preventative will help prevent more worms from growing and developing and going from the L1, 2, 3 phase to the adult phase, but you're kind of stuck with the adults. And if that happens and a veterinarian does a heartworm test for the female heartworm disease. So the veterinarian is going to look for an antigen, and it's going to be an antigen test for the female heartworm. If you have one female heartworm in your doggy, that test will ding positive. And if that testing is positive, your veterinarian is going to give you some options. Now, the best option is to treat it. Like, of course, if your dog is asymptomatic, like no symptoms, no coughing, no lethargy, nothing like that, you can go ahead and treat that doggy, okay? And it's going to vary on how much it costs. In most cases, guys, no joke, it's going to be a couple thousand. It's a lot of work. It's a lot of medicine. It's a lot of observing. It's a lot of months and months of work and follow-up to make sure the doggy recovers. If you catch it early, a lot of doggies can live very happy, healthy, very normal lives. if you don't catch it early, that's when you get a lot of secondary problems. So we think about heartworm disease being like a heart issue, and it is, don't get me wrong. But a real big problem is the worms migrate into the lungs, and you get all this pathology or disease in the lungs themselves. They do autopsies or necropsies on doggies that have heartworm disease, and they find all these worms in the lungs and all of these worms that have been, kind of walled off by the body, and the lungs are super not healthy. And when I've had problems with doggies, had complications when treating heartworm disease, it's usually from the lungs and the generalized inflammation from all the. So what a vet will do, guys, is after they work your doggy up, they'll probably do some blood work, some X-rays. They may even do an ECG, but they're going to make sure your doggy's healthy enough for treatment. And if you decide to do treatment, the Heartworm Association has a beautifully laid out plan. And if you just look at that online, it literally, your veterinarian will follow that plan to a T. And that's what I do. And usually we do 3 treatments. We'll start off with some medicine like some doxycycline, maybe a steroid to reduce inflammation. And we do the doxycycline because we believe there's a bacteria that can definitely make the heartworm harder to eliminate. So we do doxycycline to kind of clean the heartworm off of any Wolbachia bacteria. And then once the heartworm has been cleaned off, then we go ahead and treat it. And treatment's usually threefold. We'll do an initial injection, and then we'll wait a month, and then we'll do 2 more injections over 24 hours. The doggy should always be monitored to make sure that we are doing well and that we are not having any complications. Your complications, guys, man, they can be, when they do happen, they can be pretty extreme. So like we're talking about cardiovascular complications, especially blood clots or emboli, or dead worms clogging up blood vessels. Like when you do have problems, they're pretty serious. So the big thing your veterinarian is going to tell you got to do is restriction. We're not going to play. We're not going to have any fun. It is going to be really lame and boring for months as we recover and we take our time. Of course, while we're treating the adults, we should be treating the babies too. Remember, your heartworm preventative covers 1, 2, and 3 larvae. So you should be doing your heartworm preventative. Your vet will have antibiotics and steroids, and they will also do 3 rounds of an immiticide to kill the adults. Now you're asking me probably, when is my dog clean? Like, when are we finally healthy? And that can take months. It can take 9 months. It can take a year. I've had some dogs, even with best practice, with 3 injections, doing everything perfectly, need additional injections a year later. Heartworm disease, it's a parasite, and parasites are challenging sometimes. So even if you do everything perfect, there is a possibility we won't clear it right away, or you may need additional care in the future. So that's why, like, we always talk about like preventative care being so helpful, and it really is. If you can do just a little bit of preventative care, guys, it will go a long way. It's just a long ways to preventing like big bills like a heartworm treatment, and it will also prevent your dog from going through a lot of medical care and just not feeling good and being uncomfortable and having a really serious disease like heartworm disease. All right, so it is time for me to go to work. I hope this was super helpful. Hey guys, if you guys have questions you want me to answer or field, just in general topics, I can't do just like individual pets, because if I haven't seen your dog or your kitty, I will never give medical advice over YouTube. But I would love to talk topics, kind of like heartworm disease here. I'm going to try to do videos on a regular basis. I promise. I will nail down an actual time I'm going to do these. But for right now, I'm just going to kind of, push them out when I have some free time, even if it is right before work and my daughter's watching Bluey and everybody's sleeping. All right, guys. Thanks for watching. I really appreciate it. I will post this. Take care.